Welcome to another deep dive with us. This time we're going to be taking a deep dive into all those notes that I took on pediatrics.
Oh, fun.
It's kind of like a cheat sheet for understanding those tiny humans, how they grow, develop, and sometimes why they attract every sniffle and ailment going around.
Yeah.
So we're going to be translating all those sometimes dense notes into um, you know something we can actually use.
I'm excited.
So let's start at the very beginning: growth and development.
Okay.
It seems like a simple concept.
It does.
But your notes hint that there's a lot more to it than just getting taller.
Yeah, it's not just about size. It's about how a child's body changes and matures over time, both physically and functionally. And the fascinating thing is how many different factors can influence this whole process.
It's like a recipe with a ton of ingredients.
Right.
And your notes talk about genetics, environment, even things like nutrition and hormones. So what stood out to you the most when you were jotting all this down?
It's fascinating how all these elements are kind of interwoven. It's not just nature versus nurture. It's a constant interplay between genes and environment and those internal factors like hormones and nutrition.
They all work together.
They all work together to shape how a child grows and develops.
Okay, let's unpack this a little bit further. Your notes mention phenotype. Basically, it's the observable characteristics,
Right.
That are influenced by genes. So it's like how some kids inherit, their dad's height or their mom's eye color.
Right. Phenotype is like the blueprint, I guess, that sets the stage for a child's growth trajectory. But then environmental factors come into play, both before and after birth, shaping how that blueprint is expressed.
So even before a baby is born, things can influence their development. Your notes specifically mention prenatal influences, like if the mother experiences malnutrition or uses substances during pregnancy.
Exactly. Those prenatal influences can have a ripple effect, shaping everything from the baby's birth weight to their overall health and development. And after birth, those environmental factors continue to play a role. Things like nutrition, access to health care, and even a child's social and emotional environment can all influence their growth trajectory.
It's a reminder that a child's environment is just as important as their genetics,
Yeah.
when it comes to reaching their full potential. Now, your notes also mention something called epiphyseal trauma. What exactly does that mean, and why is it important in the context of growth?
The epiphysis is the growth plate, so that area at the end of long bones where bone growth occurs. Trauma to that area, like a fracture or a serious injury, can actually disrupt the growth process and potentially lead to stunted growth or even limb deformities.
Wow, so it's like damaging the very engine of bone growth.
Exactly.
Makes you realize how delicate those growth plates are,
Right.
and how important it is to protect kids from serious injuries.
Yeah.
Now, your notes then go on to talk about evaluating short stature. What exactly does that mean, and what are some of the key things to consider?
Short stature is a term we use to describe a child whose height is significantly below the average for their age and sex. Typically, it's defined as being below the third percentile on standard growth charts.
So if you line up 100 kids of the same age and sex, the child with short stature would be one of the shortest 3.
Right.
But as your notes suggest, simply identifying short stature is just the first step. The real question is, why is this child shorter than expected?
Exactly. And that's where the evaluation process comes in, right? It's like detective work, trying to piece together the clues to determine what the underlying cause is.
I like that.
Your notes mention several important steps in this process, starting with accurate height measurement. It might seem obvious, but even slight errors in measurement can really throw off the whole evaluation.
It's all about precision.
Yeah.
And then what comes next?
Assessing body proportions is another key piece of the puzzle. So looking at the ratio of the upper body segment to the lower body segment can provide valuable insights into potential underlying conditions.
Okay.
For example, like a larger upper to lower segment ratio might suggest a condition like achondroplasia, which is a form of dwarfism that affects bone growth.
So it's about looking at the overall symmetry, the proportions of the body.
Exactly.
Now, your notes also emphasize the importance of comparing a child's height to their mid-parental height.
Right.
It's basically the average height of their parents.
Yes.
Why is that comparison so helpful?
It helps determine if the child's growth pattern is consistent with their genetic potential or if there are other factors at play. So if a child's height is significantly below what's expected based on their parents' heights, that raises a red flag, suggesting that further investigation is needed.
It's like trying to understand if the child is simply following their genetic blueprint or if there's something else throwing off the construction plan. Now, when it comes to those further investigations, your notes mention a whole battery of tests, from blood work to bone age assessments to even genetic testing. What are some of the key things these tests can reveal?
These tests can help uncover a wide range of underlying causes for short stature. Blood tests can check for hormonal imbalances like growth hormone deficiency or hypothyroidism, as well as nutritional deficiencies like iron deficiency anemia, which can also impact growth.
So it's about looking for those internal factors that might be hindering growth.
Exactly.
What about bone age assessments? What can those tell us?
A bone age assessment involves taking an X-ray of the hand and wrist and comparing the development of those bones to standardized charts. This can help determine if the child's skeletal maturity is consistent with their chronological age or if their bones are developing more slowly than expected.
So it's like a sneak peek into the child's internal clock, seeing if their bones are keeping pace with their age. Now, your notes also mention genetic testing. When might that be considered?
Genetic testing can be helpful in cases where there's a suspicion of a chromosomal abnormality, like Turner syndrome, or a genetic disorder that affects growth, like achondroplasia. These tests can help pinpoint the specific genetic cause of short stature, which can really guide those treatment decisions.
It's incredible how far we've come in understand the genetic basis of growth and development.
Oh, absolutely.
Now, speaking of treatment, your notes suggest that it really depends on the underlying cause.
Right.
What are some of the general approaches to treating short stature?
Well, if an underlying medical condition is identified, treating that condition is the first priority, right?
Right.
So, for example, if a child has hypothyroidism, thyroid hormone replacement therapy can help restore normal growth. And if growth hormone deficiency is diagnosed, growth hormone injections can be used to stimulate growth.
So it's about addressing those specific hormonal or medical issues that are interfering with growth. But what if there's no clear medical cause for the short stature?
Well, in those cases, ensuring adequate nutrition and promoting a healthy lifestyle can help optimize a child's growth potential. Sometimes simple interventions like ensuring the child is getting enough sleep, exercise, and a balanced diet can really make a difference.
It's a reminder that sometimes the most effective interventions are the simplest, most basic things. Now, your notes wrap up this section on growth and development with a thought-provoking question, which is, what are the long-term social and psychological impacts of short stature, and how can we support children facing these challenges?
Oh, that's an important question. And it goes beyond just the physical aspects of short stature. Children with short stature might face social stigma or teasing, and they might struggle with body image issues or feelings of inadequacy.
It's a reminder that our physical attributes can sometimes influence how we perceive ourselves and how others perceive us.
Yeah.
So how can we create a more supportive and inclusive environment for children with short stature?
Open communication is key. Parents, teachers, and healthcare providers can play a vital role in helping children understand that height is just one aspect of who they are, and that it doesn't define their worth or their potential. Encouraging children to focus on their strengths and talents, fostering a sense of self-acceptance, and just providing a safe and supportive environment where they feel comfortable expressing their feelings can all make a difference.
It's about celebrating diversity.
Absolutely.
And recognizing that everyone has something unique to offer, regardless of their height.
Yeah.
Okay, now let's move on to the next section of your notes, which is all about milestones.
Milestones. Okay.
Milestones are those exciting developmental markers that we eagerly anticipate as parents.
Yes.
And healthcare providers. They represent those incredible leaps in a child's physical, cognitive, and social-emotional development.
It's like watching those little humans transform right before our eyes.
It really is. But as your notes suggest, tracking those milestones isn't just about celebrating those adorable first steps or that first mama or dada. It's also about identifying potential delays or concerns.
Exactly. Milestones provide a roadmap for development, helping us ensure that children are progressing as expected. And if there are any delays or concerns, early identification is crucial for intervention.
Okay, so let's dive into some specific milestones. Your notes focus on a 9-month-old child. So what are some of the key developmental markers we might expect to see at this age?
By 9 months, most babies are on the move. So they're sitting without support, crawling, pulling themselves up to stand, and some might even be taking those first tentative steps.
It's like they're suddenly exploring their world with newfound mobility.
Absolutely.
What about What about fine motor skills? What are their little hands up to at this age?
Yeah. Their fine motor skills are also refining. They've mastered that adorable pincer grasp, using their thumb and index finger to pick up small objects, and they're starting to transfer objects between their hands, which is a key step in developing hand-eye coordination.
It's amazing to watch them manipulate objects with increasing dexterity.
Mhm.
Now, beyond those, physical milestones, your notes also mention social and emotional development. So, what's happening in that realm at 9 months?
Yeah, around this age, babies start showing stranger anxiety, which is a perfectly normal developmental stage. They've developed a strong attachment to their primary caregivers, and so they might become clingy or distressed when separated from them or when unfamiliar people approach.
So it's not necessarily a bad thing.
Not at all.
It's a sign that they've formed those, crucial social bonds. But your notes also mention peekaboo.
Yeah.
Why is that significant?
Peekaboo is more than just a fun game. It's actually a developmental milestone. It signifies that the baby is starting to understand object permanence, the concept that objects continue to exist even when they're out of sight.
So when they're giggling and squealing during peekaboo, they're not just being adorable.
They're working on their cognitive skills.
They're demonstrating their growing cognitive abilities.
Right.
Now, what about language development? Where are those little chatterboxes at 9 months?
Yeah, by 9 months, most babies are babbling away, experimenting with different sounds and syllables. They're starting to understand simple words like no and bye-bye, and they might even respond to their name.
Oh, yeah.
It's, the foundation for language development, and it's a joy to witness.
It's incredible how quickly those communication skills emerge. Now, before we move on from milestones, your notes mention something called primitive reflexes. What are primitive reflexes, and why are they important to consider in the context of development?
Primitive reflexes are those automatic, involuntary movements that babies are born with. They're controlled by the brainstem, and they gradually disappear as the brain matures. These reflexes serve important functions in those early months of life, helping babies adapt to their new environment and develop basic motor skills.
So they're like pre-programmed responses that are essential for survival and development.
Exactly.
What are some examples of these primitive reflexes?
One well-known example is the sucking reflex, which allows babies to instinctively latch onto a breast or bottle and feed. Another is the rooting reflex, where a baby will turn their head towards a touch on their cheek, helping them find a food source. And then there's the grasping reflex, where a baby will automatically grasp an object placed in their hand.
It's amazing to think about how our bodies are hardwired with these automatic responses that are crucial for survival in those early days and weeks of life. But as you mentioned, these reflexes eventually disappear. Why is that important?
Well, the disappearance of primitive reflexes is a sign that the brain is maturing and that higher brain centers are taking over control of movements.
Okay.
If these reflexes persist beyond a certain age, it can be a red flag for developmental delays or neurological problems.
So it's like a sign that the brain's wiring is progressing as expected.
Exactly.
Now, your notes end this section on milestones with a thought-provoking question. How do cultural practices and parenting styles influence the development of milestones in different parts of the world? It makes you wonder about all the different ways children learn and grow across cultures.
It's a fascinating area of study. Culture and parenting practices play a significant role in shaping a child's development. For example, in some cultures, babies are carried for much of the day, which can promote motor development and social interaction.
Oh, interesting.
In other cultures, babies might spend more time on their backs, which can encourage visual exploration and reaching for objects.
It's a reminder that there's no one-size-fits-all approach to child development. Different cultures have different ways of nurturing and supporting their children's growth. Now let's move on to the next topic in your notes, which is microcephaly. It sounds a bit intimidating, so what exactly is it?
Microcephaly is a condition where a baby's head circumference is significantly smaller than expected for their age and sex. It's typically defined as a head circumference that's more than 2 standard deviations below the average.
So it's not just about having a small head.
Right.
It's about having a head that's significantly smaller than what's considered typical for a baby's age and sex. What causes microcephaly?
There are a number of potential causes, including genetic disorders, infections during pregnancy, exposure to toxins or radiation, and even severe malnutrition.
So it's a condition that can have a variety of origins, both genetic and environmental. Now, one of the things that stood out to me in your notes is that microcephaly can be present at birth, but it can also develop after birth.
Yeah.
Why does that happen?
Well, in some cases, the underlying cause of microcephaly might not be apparent at birth. For example, a child might have a genetic disorder that affects brain growth, but it doesn't manifest until later in infancy or childhood. Or, they might experience an infection or injury after birth that damages the brain and disrupts its growth.
So it's not always a straightforward diagnosis.
Right.
It might require, ongoing monitoring and evaluation to determine the cause and the potential implications.
Yeah.
Now, one of the big concerns with microcephaly is that it's often associated with developmental delays or disability.
Right.
Why is that?
Well, the brain is the control center for the entire body, and when its growth is restricted, it can impact a wide range of functions, including motor skills, cognitive abilities, language development, and even sensory processing.
It's a reminder that the brain is a complex and delicate organ that requires the right conditions to develop and function properly. Now, your notes wrap up this section on microcephaly with a thought-provoking question. What are the ethical considerations surrounding prenatal testing for microcephaly? And how can we ensure families have access to accurate information and support?
Prenatal testing can provide valuable information about a developing fetus, but it can also raise difficult ethical dilemmas, especially when it comes to conditions like microcephaly, which can have a wide range of potential outcomes. Families facing these diagnoses need access to accurate information, genetic counseling, and support services to help them navigate the complex decisions and emotions involved.
It's a reminder that healthcare is about more than just tests and diagnoses.
Absolutely.
It's about providing compassionate care and empowering families with the knowledge and support they need to make, informed choices.
Okay, now let's move on to another topic that caught my eye in your notes. Dwarfism. It's a condition that often sparks curiosity and questions. But it's important to approach this topic with sensitivity and understanding.
Absolutely.
Yeah.
Dwarfism is a term used to describe a condition characterized by short stature, typically defined as an adult height that's 4 feet 10 inches or less. It's a complex condition that can have a variety of causes, both genetic and medical.
Now, your notes mention two main types of dwarfism, proportionate and disproportionate.
Right.
Can you explain the difference between these two types?
In proportionate dwarfism, all parts of the body are smaller than average, but they're in proportion to each other. It's like a miniature version of a typically proportioned body. This type of dwarfism is often caused by hormonal or metabolic disorders that affect overall growth.
So it's a general slowing down of growth that affects the entire body.
Exactly.
But what about disproportionate dwarfism? In disproportionate dwarfism, the body has an uneven growth pattern. Some parts of the body, like the arms and legs, might be significantly shorter than average, while other parts, like the torso, might be closer to typical size. And this type of dwarfism is usually caused by genetic disorders that specifically affect bone growth.
So it's like a glitch in the body's blueprint, leading to uneven growth in different parts of the skeleton. Now, your notes also mention management options for dwarfism, and it sounds like it's not just about addressing height.
Exactly. While some individuals with dwarfism might choose limb lengthening procedures to increase their height, management often focuses on addressing any medical issues associated with the underlying condition, promoting overall well-being, and just providing support and resources to individuals and families affected by dwarfism.
It's a reminder that healthcare is about more than just, treating symptoms. It's about addressing the whole person and empowering them to live, a full and fulfilling life, regardless of their physical stature. Now, your notes end this section on dwarfism with a thought-provoking question. How can society better accommodate the needs of people with dwarfism, promoting inclusivity and accessibility in all aspects of life?
Oh, it's a call to action for all of us to create a more inclusive and accessible world for people with dwarfism. This might involve designing buildings and public spaces with their needs in mind, promoting positive representations of dwarfism in media and popular culture, and just challenging societal biases and stereotypes.
It's about recognizing that diversity comes in all shapes and sizes,
Absolutely.
and that everyone deserves to be treated with respect and dignity. Okay, now let's shift gears a bit and explore some common behavioral issues in children. Your notes start off with a topic that's often both puzzling and alarming for parents.
Yeah.
Breath-holding spells.
Breath-holding spells, right.
Yeah.
These are those episodes where a child, usually between 6 months and 6 years old, temporarily stops breathing and might even lose consciousness. They're often triggered by strong emotions like anger, frustration, or pain, and they can be quite dramatic to witness.
I can imagine. As a parent, it would be terrifying to see your child suddenly stop breathing and, turn blue. But your notes emphasize that these spells are usually harmless and don't cause any long-term damage. So why do they happen? And what can parents do to manage them?
Well, the exact mechanism behind breath-holding spells is still not fully understood, but they're thought to be a reflex response to a trigger that causes a temporary drop in heart rate and blood pressure.
So it's like their little bodies have this um, dramatic but ultimately harmless reaction to, just strong emotions.
Exactly. Now, managing breath-holding spells involves a combination of prevention and reassurance. If you know what triggers your child's spells, try to avoid those situations or prepare your child in advance. And if a spell does occur, try to stay calm and reassure your child that they'll be okay. It's also important to rule out any other medical conditions, like seizures, that might mimic breath-holding spells.
It's a reminder that while these spells are usually harmless, it's always best to err on the side of caution and seek medical advice if you have any concerns. Now, moving on from breath-holding spells, your notes dive into another common behavioral challenge, attention deficit hyperactivity disorder, or ADHD.
ADHD.
What is it? What are the key things to know about ADHD?
ADHD is a neurodevelopmental disorder characterized by inattention, hyperactivity, and impulsivity. It's a complex condition that can affect a child's ability to learn, socialize, and function in everyday life.
So it's not just about being a busy or a distractible child.
Mm.
It's about having these, persistent and significant difficulties with attention, impulse control, and activity levels.
Exactly. And it's important to remember that ADHD is not a sign of bad parenting or a lack of willpower. It's a real neurological condition that requires professional evaluation and management.
Now, diagnosing ADHD can be challenging because, the symptoms can overlap with other conditions.
Right.
And there's no single test that can confirm the diagnosis.
Mm.
What are some of the key things that healthcare providers look for when evaluating a child for ADHD?
The diagnosis of ADHD is based on a comprehensive evaluation that includes a detailed history, interviews with parents and teachers, behavioral observations, and sometimes standardized rating scales or questionnaires. The key is to gather information from multiple sources to get a complete picture of the child's behavior and functioning.
So it's about piecing together those different pieces of information to understand the child's unique challenges.
Right.
Now, once a diagnosis of ADHD is made, what are the management options?
Managing ADHD often involves a combination of behavioral therapy, medication, and educational support. Behavioral therapy focuses on teaching children coping mechanisms and strategies for managing their inattention, impulsivity, and hyperactivity.
So it's about providing tools and techniques to help them navigate those challenges.
Exactly.
What about medication?
Medication can be helpful for some children with ADHD, particularly those with moderate to severe symptoms. The most commonly prescribed medications are stimulants, which can help improve attention and focus. But it's important to remember that medication is not a cure for ADHD.
Right.
It's most effective when used in conjunction with behavioral therapy and other supportive interventions.
It's about finding the right balance of strategies to help each child thrive. Now, your notes end this section on ADHD with an important question. How can we reduce the stigma surrounding ADHD and support individuals with this condition to thrive in, academic and social settings?
Reducing stigma starts with education and understanding. It's about recognizing that ADHD is a real neurological condition, not a character flaw or a lack of discipline.
Right.
Open communication, empathy, and support from parents, teachers, and peers can make a world of difference for children with ADHD, helping them feel understood and valued.
It's about creating an inclusive environment where children with ADHD can reach their full potential, without shame or judgment. Okay, now let's move on to another behavioral issue that's mentioned in your notes.
Pica.
What is pica, and why is it a concern?
Pica is a condition characterized by the persistent eating of non-food substances, things like dirt, clay, paint chips, or even hair. It can occur at any age, but it's most common in young children.
It seems like such a strange behavior, potentially dangerous behavior.
Yeah.
Why do children engage in pica?
Well, the underlying causes of pica are not always clear, but they can range from nutritional deficiencies like iron deficiency anemia to developmental disorders like autism to even psychological factors like stress or anxiety.
So it's a behavior that can have a variety of roots, and it often requires a thorough evaluation to determine the underlying cause. Now, one of the big concerns with pica is the potential for poisoning or other, health problems. Why is that?
Eating non-food substances can expose children to a whole range of toxins and contaminants, including lead, pesticides, parasites, and even bacteria. This can lead to a variety of health problems, from gastrointestinal issues to lead poisoning to even infections.
It's a reminder that even seemingly harmless substances can pose, serious health risks when ingested.
Right.
Now, how is pica managed?
Managing pica involves a combination of identifying and addressing the underlying cause, providing behavioral therapy to discourage the behavior, and just making the environment safer by removing access to non-food substances.
It's a multi-pronged approach that addresses both the physical and the behavioral aspects of pica.
Right.
Okay, now let's move on to another common childhood behavior that often sparks questions for parents. Thumb sucking. Is it really something to worry about?
Thumb sucking is a natural self-soothing behavior that's common in infants and toddlers. It usually peaks around 18 to 21 months of age and typically disappears by the time a child reaches 4 years old.
So for the most part, it's a normal and harmless behavior,
Right.
but your notes suggest that persistent thumb sucking in older children can sometimes lead to dental problems.
Yeah.
What are some of the potential concerns?
If thumb sucking continues beyond the age of 4 or 5, it can start to affect the alignment of the teeth, potentially leading to an overbite or other orthodontic problems. It can also affect the shape of the palate, the roof of the mouth.
So it's about finding that balance between allowing a child to engage in this natural self-soothing behavior, but also being mindful of the potential long-term consequences.
Right.
Now, how do you approach thumb sucking with an older child who might be, resistant to giving up this habit?
The key is to be patient and understanding. Punishment or shaming is never helpful. Instead, focus on positive reinforcement. Praising the child when they're not sucking their thumb, offering rewards for progress. You can also try to redirect their attention to other activities when they feel the urge to suck their thumb. And if you're concerned about potential dental problems, talk to your child's dentist. They can offer advice and support. They might even recommend a dental appliance to help discourage thumb sucking.
It's a reminder that even challenging behaviors can often be addressed with patience, understanding, and a bit of creativity.
Absolutely.
Okay, now let's dive into the crucial world of nutrition.
Okay.
Your notes are packed with information about the role of nutrition in a child's growth and development, and they start off strong by tackling one of the most serious nutritional issues facing children worldwide: protein energy malnutrition, or PEM.
PEM, yeah, it's a devastating condition that results from a lack of adequate protein, calories, and other essential nutrients. It's often associated with poverty, food insecurity, and inadequate access to health care, and it can have devastating consequences for a child's physical, cognitive, and emotional development.
PEM sounds incredibly serious.
It is.
It's like trying to build a strong and healthy body without the essential building blocks.
Exactly. And the effects of PM can be far-reaching, impacting everything from growth and brain development to immune function and overall health.
So what are the key causes of PM? Your notes seem to highlight a complex interplay of factors.
Insufficient food intake is the most obvious cause.
Right.
And this can be due to a variety of factors, including poverty, famine, war, or even natural disasters.
It's a reminder that food security is a fundamental human right.
Absolutely.
And that for many children around the world, access to adequate food is a daily struggle.
It is.
But as you mentioned, it's not just about the amount of food available.
Yeah.
The quality of the diet is just as important.
Absolutely. A child might be getting enough calories, but if their diet lacks essential nutrients like protein, vitamins, and minerals, they can still develop PM.
It's like trying to run a car on empty or low-quality fuel.
Yeah.
It might sputter along for a while, but it won't perform at its best, and it could eventually break down.
That's a great analogy.
And then there are other factors that can contribute to PM, like infections and chronic illnesses, which can interfere with nutrient absorption or increase the body's demand for nutrients.
Exactly.
It's a reminder that PM is often a symptom of a larger problem, and that addressing it requires this holistic approach that considers, the child's overall health and well-being,
Right.
as well as their social and economic circumstances.
Absolutely.
Now, your notes go on to describe the different classifications of PM,
Right.
and they can get a bit technical.
They can.
But it's helpful to understand the various ways this condition can manifest.
Right.
Okay, let's break it down. What are the key classifications, and what are the defining features of each?
Okay, the most widely recognized classification distinguishes between two main types. We have kwashiorkor
Okay.
and marasmus. Kwashiorkor is characterized by edema, or swelling,
Okay.
often in the legs and feet, along with skin lesions, hair changes, and an enlarged liver. It's primarily caused by a severe deficiency of protein, even if the child is getting enough calories.
So it's like the body is starving for protein,
Exactly.
even if it's getting enough energy from other sources.
Yes.
What about marasmus?
Marasmus, I know. Marasmus, on the other hand, is characterized by severe wasting or emaciation. The child looks incredibly thin and frail, their muscles are wasted, and their body fat is depleted. It's caused by an overall deficiency of calories and nutrients, often due to prolonged starvation.
So it sounds like kwashiorkor is more about a lack of protein,
Hmm.
while marasmus is more about a lack of overall nourishment.
Exactly.
Now, your notes also mention anthropometric classifications of PEM.
Right.
What are those?
Anthropometric classifications rely on measurements of weight, height, and other body parameters to assess a child's nutritional status. These measurements are compared to standardized growth charts to determine if a child is underweight, stunted, or wasted.
So it's like using a ruler and a set of standards to evaluate, a child's growth and development.
Exactly.
Now, what about managing PM? It sounds like a complex and challenging condition to treat.
Managing PM requires a multifaceted approach that addresses both the immediate nutritional needs and the underlying causes. In severe cases, hospitalization might be necessary to provide intensive nutritional support, including intravenous fluids and specialized therapeutic foods.
So it's about providing that critical nourishment to stabilize the child's condition
Right.
and prevent further deterioration.
Exactly.
But what about the long-term management of PM?
The long-term management of PEM focuses on promoting healthy growth and development, addressing any underlying medical conditions, providing nutritional education and counseling to families, and addressing the social and economic factors that contribute to food insecurity.
It's a reminder that PEM is often a symptom of a larger problem,
Yes.
and that addressing it requires a holistic approach that considers, the child's overall well-being and the context of their environment.
Absolutely.
Now, before we move on to the next nutritional deficiency, your notes highlight specific detail about the World Health Organization's criteria for defining severe acute malnutrition, or SAM.
SAM.
What are those criteria, and why are they important?
The WHO defines SAM as a weight for height that's more than 3 standard deviations below the average, the presence of bilateral pitting edema, or a mid-upper arm circumference that's less than 11.5 centimeters. These criteria are used to identify children who are at high risk for complications and death from malnutrition and to prioritize them for intensive treatment and support.
So it's like a triage system for malnutrition,
Exactly.
helping healthcare providers
Yeah.
identify those children who need the most urgent care.
Right.
Okay, now let's move on from PEM and delve into another nutritional deficiency that's mentioned in your notes: rickets.
Yeah.
What is rickets, and how does it affect a child's development?
Rickets is a bone disease that's primarily caused by a deficiency of vitamin D.
Okay.
Vitamin D plays a crucial role in calcium absorption, and without enough calcium, bones can become soft and weak, leading to skeletal deformities and other health problems.
So it's like trying to build a house with weak or brittle bricks.
Yeah.
The structure might not be able to support its own weight, and it could even collapse. Now, vitamin D is often called the sunshine vitamin because our bodies can produce it when our skin is exposed to sunlight. But as your notes suggest, it's not always as simple as just getting enough sun. What are some of the other factors that can contribute to rickets?
Yeah, you're right. While inadequate sunlight exposure is a common cause of vitamin D deficiency, there are other factors that can play a role, including inadequate dietary intake of vitamin D, problems with vitamin D absorption, certain medical conditions that interfere with vitamin D metabolism, and even some medications that can deplete vitamin D levels.
It sounds like a complex interplay of factors that can lead to this deficiency.
It is.
Now, what are some of the classic signs and symptoms of rickets?
Well, the most noticeable signs are skeletal deformities, like bowed legs, knock knees, or a protruding breastbone. Children with rickets might also have delayed growth, muscle weakness, and bone pain.
So it's a condition that can affect both the appearance and the function of the skeleton. Now, how is rickets diagnosed and treated?
Diagnosing rickets involves a combination of a physical exam, x-rays to assess bone development, and blood tests to measure vitamin D, calcium, and phosphorus levels. Treatment typically involves vitamin D supplementation, often in high doses, to replenish those depleted stores and restore normal bone mineralization.
So it's about providing that crucial vitamin D to help to help those bones rebuild and strengthen.
Right.
Now, before we move on from rickets, your notes mention a fascinating detail about the radiological findings in this condition. They describe something called cupping, splaying, and flaying.
Oh, yeah.
What exactly does that refer to?
Those terms describe the characteristic changes seen in the growth plates of long bones affected by rickets.
Okay.
Cupping refers to a concave or scooped-out appearance at the ends of the bones.
Okay.
Splaying describes a widening or flaring of the metaphysis, which is the growth plate region.
Okay.
And flaying refers to a frayed or irregular appearance of the bone at the growth plate.
Wow. It sounds like a rather dramatic description,
It is.
but it highlights how rickets can actually alter the structure of the bones at a microscopic level.
Exactly, and those radiological findings can help confirm the diagnosis and guide treatment. Now, moving on from rickets, your notes shift gears a bit and delve into another crucial nutritional deficiency, vitamin A deficiency.
Vitamin A is essential for a whole range of bodily functions, including vision, immune function, and cell growth. It's like a multitasking vitamin that's critical for maintaining overall health. But as your notes suggest, vitamin A deficiency is a serious problem in many parts of the world, particularly in developing countries.
You're right. Vitamin A deficiency is a leading cause of preventable blindness in children, and it can also increase the risk of infections and other health problems.
So it's a deficiency with far-reaching consequences. Now, what are some of the key things to understand about this deficiency? What are the signs and symptoms, and how is it addressed?
One of the key things to understand is that vitamin A deficiency often manifests in the eyes.
Okay.
It can cause a range of eye problems, from night blindness, where it becomes difficult to see in low light conditions,
Right.
to dry eyes, where the eyes don't produce enough tears, to even more serious conditions like corneal ulcers and keratomalacia, which can lead to blindness.
Wow. It's a reminder that our eyes are incredibly complex and delicate organs that rely on a steady supply of nutrients to function properly.
Yeah.
Now, how is vitamin A deficiency addressed? Your notes mention several strategies, both short-term and long-term.
In the short term, high-dose vitamin A supplements can be incredibly effective in replenishing those depleted stores and reversing the deficiency. These supplements are often distributed through mass immunization programs in areas where vitamin A deficiency is prevalent.
So it's a targeted approach to addressing a widespread problem.
Exactly.
But what about those long-term strategies? How do we prevent vitamin A deficiency from recurring?
The long-term strategies focus on improving nutrition and food security. This might involve promoting breastfeeding, encouraging dietary diversification, fortifying staple foods with vitamin A, and even addressing poverty and other social determinants of health that contribute to malnutrition.
It's a reminder that good nutrition is a cornerstone of good health,
Absolutely.
and that addressing nutritional deficiencies requires a multifaceted approach that considers both the individual and their environment.
Right.
Okay, now let's shift gears a bit and talk about one of the most natural and beneficial aspects of infant nutrition,
Yeah.
breastfeeding. Your notes are packed with information about the numerous benefits of breastfeeding, both for the baby and the mother. Where should we start?
Let's start with the baby. Breast milk is truly nature's perfect food for infants. It provides all the nutrients a baby needs for optimal growth and development during those crucial first 6 months of life, and it continues to provide valuable nutrients and immune protection for as long as breastfeeding continues.
It's like a customized nutritional cocktail that adapts to the baby's needs as they grow. What are some of those key nutrients found in breast milk?
Breast milk is packed with protein, fats, carbohydrates, vitamins, and minerals, all in the right proportions for a growing baby. It also contains antibodies and other immune factors that help protect babies from infections.
So it's not just about nourishment. It's about providing those tiny immune systems with a boost. Now, your notes also mention the importance of exclusive breastfeeding. What exactly did that mean?
Exclusive breastfeeding means that the baby receives only breast milk with no other food or drink, not even water, for the first 6 months of life.
So it's about giving breast milk a chance to shine as the sole source of nourishment.
Right.
Why is exclusive breastfeeding so important?
Exclusive breastfeeding offers numerous benefits. It helps protect babies from infections, reduces the risk of allergies and other health problems, and promotes optimal growth and development. It also helps establish a strong bond between mother and baby.
It's a reminder that breastfeeding is more than just a way to, to feed a baby.
Right.
It's a nurturing experience that fosters a deep connection between mother and child. Now, your notes mention a specific component of breast milk that's particularly beneficial for newborns, colostrum.
Colostrum, right.
What is colostrum, and what makes it so special?
Colostrum is the first milk that a mother produces after birth. It's thick, yellowish, and packed with antibodies, immune factors, and growth factors. It's often called liquid gold because it provides crucial protection for newborns in those first few days of life.
It's like a supercharged dose of immunity and nourishment. What are some of the specific benefits of colostrum for newborns?
Well, colostrum helps protect newborns from infections, promotes the development of a healthy gut microbiome, and even helps clear bilirubin from the body, reducing the risk of jaundice.
Wow. It's incredible how nature has designed this perfect first food to meet the unique needs of newborns.
Hmm.
Now, as we continue exploring, the benefits of breast milk, your notes highlight some specific anti-infective factors found in breast milk, and the names are a bit of a mouthful, but I'm curious to learn more about them.
Sure.
What are these factors all about?
Let's break them down. One of the key players is secretory IgA, which is an antibody that's specifically designed to protect the mucosal surfaces, like the lining of the gut. It acts as a barrier, preventing harmful bacteria and viruses from attaching to those surfaces and causing infection.
So it's like a frontline defense system for the baby's digestive system.
Exact.
What about the other factors?
Another important one is lactoferrin, a protein that binds iron, making it unavailable to bacteria that need it to grow.
It's like cutting off their supply lines.
Exactly. Then there's lysozyme, an enzyme that breaks down bacterial cell walls, essentially destroying those harmful invaders.
Wow.
And finally, there's bifidus factor, which promotes the growth of beneficial bacteria in the baby's gut, creating a healthy balance of gut flora that helps with digestion and immune function.
It's amazing how breast milk is like a sophisticated pharmacy equipped with all these, targeted defenses against infection. Now, before we move on from breastfeeding, your notes mentioned the 10 steps to successful breastfeeding. A set of guidelines developed by the WHO and UNICEF.
Right.
What are these 10 steps all about?
The 10 steps are essentially a roadmap for hospitals and healthcare facilities to create a supportive environment for breastfeeding. They cover everything from having a written breastfeeding policy to training healthcare staff on breastfeeding support to promoting practices like rooming in, where mothers and babies stay together 24/7, fostering that crucial bond and allowing for on-demand feeding.
It's a reminder that breastfeeding is not just a personal choice. It's a public health priority that deserves support and encouragement. Okay, now let's move on to another important topic in infant nutrition. Premature infants and those with intrauterine growth restriction, or IUGR.
Right.
What are the key things to understand about the nutritional needs of these babies?
Premature babies and those with IUGR often have special nutritional needs because they might be born with underdeveloped organs and systems, including their digestive systems. They might also have difficulty sucking and swallowing, making breastfeeding or bottle feeding more challenging.
So it's about providing the right nutrients in a way that their tiny bodies can handle. What are some of the strategies used to meet the nutritional needs of these, vulnerable infants?
Well, if a premature baby is unable to breastfeed or bottle feed effectively, they might be fed through a tube that goes directly into their stomach or intestines. This ensures that they're getting the nutrients they need, even if they're not able to suck or swallow effectively.
So it's like a bypass system that delivers nutrition directly to where it's needed. What about the specific nutrients? Are there any special considerations for premature babies and those with IUGR?
Yes, these babies often need higher concentrations of protein, calories, and certain vitamins and minerals to support their rapid growth and development. They might also need supplements like iron or calcium to address any deficiencies.
It's like providing a supercharged nutritional boost to help them catch up and thrive.
Exactly.
Now, as we move on to the next section of your notes, we're going to explore a whole range of common childhood illnesses. Let's start with one that's practically a rite of passage for newborns: neonatal jaundice.
Neonatal jaundice.
Explain that one to me.
Neonatal jaundice is a common condition that causes a yellowing of the skin and eyes in newborns. It's caused by a buildup of bilirubin in the blood. which is a yellow pigment that's produced when red blood cells break down.
Okay. I've heard that jaundice is often a harmless condition that resolves on its own, but your notes suggest that there are different types of jaundice, and some are more serious than others.
That's right. Most cases of neonatal jaundice are what we call physiological jaundice, which is a normal and usually harmless condition that occurs because a newborn's liver is still immature and might not be able to process bilirubin as efficiently as an adult liver.
So it's like uh, a temporary lag in liver function that resolves as the baby
Yeah.
matures.
Right.
But what about those more serious types of jaundice?
Pathological jaundice, on the other hand, is a more serious form that can be caused by a variety of factors, including blood group incompatibility, infections, liver disease, and certain metabolic disorders.
So those are red flags that warrant further investigation.
Exactly.
Now, one of the things that caught my eye in your notes is this visual assessment tool called Kramer's Rule. What is Kramer's Rule, and how is it used to evaluate jaundice?
Kramer's rule is a simple but effective tool that helps healthcare providers estimate the level of bilirubin in a baby's blood based on the location of the jaundice on the body.
So it's like a visual roadmap for jaundice.
Exactly.
How does it work?
Basically, the more areas of the body that are affected by jaundice, the higher the bilirubin level is likely to be. So, for example, if the jaundice is limited to the face, it's usually a mild case. But if it extends down to the chest, abdomen, or even the legs and feet, it suggests a higher bilirubin level and might require treatment.
It's a simple but clever way to get a quick assessment of the severity of the jaundice. Now, what about treating neonatal jaundice? What are some of the options?
The treatment for neonatal jaundice depends on the severity and the underlying cause. For mild cases of physiological jaundice, no treatment might be necessary. The jaundice often resolves on its own as the baby's liver matures and becomes more efficient at processing bilirubin. But for more severe cases, especially pathological jaundice, phototherapy is often used.
I've heard of phototherapy. What exactly is it, and how does it work?
Phototherapy is a fascinating treatment that uses special blue lights to help break down bilirubin in the baby's skin. The baby is placed under these lights, usually wearing only a diaper and eye protection, and the light energy helps convert bilirubin into a form that can be more easily excreted by the body.
So it's like a high-tech sunbathing session for babies,
Exactly.
and it's remarkably effective in lowering bilirubin levels.
Yeah.
Now, what about exchange transfusion? Your notes mention that as well.
Exchange transfusion is a more invasive procedure that's reserved for severe cases of jaundice that don't respond to phototherapy or when there's a concern about complications. It involves replacing the baby's blood with donor blood to rapidly reduce bilirubin levels.
It's like a blood swap that aims to quickly remove that excess bilirubin
Right.
and prevent potential damage. Now, moving on from neonatal jaundice, your notes dive into another breathing problem that's common in premature babies, respiratory distress syndrome, or RDS. We briefly touched upon RDS earlier, but let's delve into it a bit deeper. What exactly causes RDS, and what are the signs and symptoms?
RDS occurs when a baby's lungs aren't fully developed and lack a substance called surfactant,
Right.
which helps keep the tiny air sacs in the lungs open. Without enough surfactant, the air sacs collapse, making it difficult for the baby to breathe.
So it's like trying to inflate a balloon that's stuck together.
Yeah.
It takes a lot more effort, and it might not inflate properly.
Right.
What are some of the signs that a baby might be experiencing RDS?
Babies with RDS often have rapid breathing, which is called tachypnea, and they might have retractions where the chest sinks in with each breath as they struggle to get air in. They might also grunt with each breath, and they might have a bluish tinge to their skin, which is called cyanosis, due to low blood oxygen levels.
It sounds like a distressing situation for both the baby and the parent.
Yeah.
Now, how is RDS managed? It sounds like a delicate situation that requires specialized care.
Managing RDS often involves a combination of supportive care and more intensive interventions, depending on the severity of the condition. Supportive care might include providing supplemental oxygen, maintaining a warm and humidified environment, and carefully monitoring the baby's vital signs.
So it's about creating a stable and supportive environment for those tiny lungs to do their work.
Exactly.
But what about those more intensive interventions?
For more severe cases, continuous positive airway pressure, or CPAP, might be used. CPAP delivers a continuous flow of air pressure through a mask or nasal prongs, helping keep the air sacs open and improving oxygenation.
And in the most severe cases, what happens then?
In those critical situations, mechanical ventilation might be necessary. This involves using a machine to breathe for the baby, giving their lungs a chance to rest and recover.
Wow. It's a reminder of the incredible advances in neonatal intensive care that allow us to support these tiny babies as their bodies develop. Now, your notes also highlight a revolutionary treatment for RDS surfactant replacement therapy. What's the idea behind this therapy, and how does it work?
Surfactant replacement therapy involves administering artificial surfactant directly into the baby's lungs, usually through a breathing tube. It's like giving those tiny air sacs the boost they need to stay open and function properly.
It's amazing how we can mimic those crucial substances that the body needs. Now, before we move on from RDS, your notes emphasize the role of antenatal corticosteroids,
Right.
which are medications given to mothers at risk of preterm delivery. How do these medications help?
Antenatal corticosteroids, typically betamethasone or dexamethasone, are given to mothers who are at risk of delivering prematurely to help accelerate lung development in the fetus. If a mother is at risk of delivering before 34 weeks of gestation, these medications can significantly reduce the risk and severity of RDS.
Wow. It's a preventative measure that can make a world of difference for these vulnerable babies.
Yeah.
Okay, now let's move on from breathing problems and talk about another category of challenges they can arise during birth. Birth injuries. What are birth injuries, and what are some of the things that can cause them?
Birth injuries are physical harms that occur during labor or delivery, and they can range in severity from minor to life-threatening. They can be caused by a variety of factors, including prolonged labor, a large baby, an abnormal fetal position, or the use of instruments like forceps or a vacuum extractor during delivery.
Wow, it sounds like there are a lot of potential variables that can complicate the birth process.
There certainly are, and while most babies are born healthy and without complications, it's important to be aware of the potential for birth injuries and to seek medical attention promptly if any concerns arise.
Okay, so let's talk about some specific types of birth injuries. Your notes focus on a condition called cephalohematoma, which sounds a bit intimidating. What exactly is cephalohematoma, and what causes it?
A cephalohematoma is a collection of blood between the skull and the periosteum, which is the membrane that covers the bone. It's usually caused by trauma to the head during delivery, often from the pressure of the baby's head against the mother's pelvic bones.
So it's like a blood blister on the skull.
Exactly.
Sounds painful. How is cephalohematoma treated, and what are the potential complications?
Most cephalohematomas resolve on their own within a few weeks or months. No specific treatment is usually necessary, but it's important to monitor the swelling and watch for signs of infection.
So it's more about observation and reassurance than active intervention.
Right. Now, one potential complication of cephalohematoma is jaundice, which we talked about earlier. If the cephalohematoma is large, the breakdown of the blood can lead to an increase in bilirubin levels, which can cause jaundice.
It's a reminder that even seemingly minor birth injuries can sometimes have cascading effects.
Yeah.
Now, what about other types of birth injuries? Your notes mention a few more.
Another common one is caput succedaneum, which is swelling of the scalp that crosses suture lines, those fibrous joints between the skull bones. It's caused by pressure on the baby's head during labor, and it's usually harmless and resolves on its own within a few days.
So it's a soft tissue swelling, unlike cephalohematoma, which involves bleeding under the periosteum.
That's right. And your notes also mentioned clavicle fracture, which is a break in the collarbone. It's one of the most common birth injuries, and it usually occurs during a difficult delivery, especially if the baby's shoulders get stuck.
So it's a matter of those little bones being subjected to forces they're not quite ready to handle.
Exactly. Now, the good news is that most clavicle fractures heal well with minimal intervention. Sometimes a simple sling might be used to support the arm, but often no treatment is necessary other than gentle handling and pain relief.
It's a reminder that the body has an incredible capacity for healing, even in those early days of life.
It does.
Now, moving on from birth injuries,
Yeah.
your notes delves into another common neonatal concern: hypoglycemia. What are the key things to know about hypoglycemia in newborns?
Hypoglycemia, which is low blood sugar, is a common problem in newborns, especially those born prematurely, those with IUGR, and those born to mothers with diabetes.
Right. We briefly touched upon hypoglycemia earlier, but let's dive into it a bit deeper. What defines hypoglycemia in a newborn, and what are the signs and symptoms?
In newborns, hypoglycemia is generally defined as a blood sugar level below 40 milligrams per deciliter. Glucose is the primary energy source for the brain, and when levels drop too low, it can have serious consequences.
Wow. So, what are some of the signs that a baby might be hypoglycemic?
The symptoms can be subtle and vary from baby to baby.
Okay.
Some babies might not show any obvious signs at all, while others might exhibit jitteriness, tremors, lethargy, poor feeding, irritability, or even seizures.
Wow. It's a reminder that newborns can't always communicate their needs verbally, so we have to rely on these subtle cues to understand what they're experiencing. Now, how is hypoglycemia managed in newborns?
The primary goal of managing hypoglycemia in newborns is to raise their blood sugar levels quickly and safely.
Okay.
This might involve early and frequent feedings, especially breastfeeding, or, if necessary, giving the baby a glucose solution or intravenous glucose.
So it's about providing that crucial sugar boost to fuel those
Yeah.
tiny brains and bodies.
Oh.
Now, before we move on from hypoglycemia, you mentioned that babies born to mothers with diabetes are at increased risk for this condition.
Right.
Why is that?
When a mother has diabetes, especially if her blood sugar levels are not well controlled during pregnancy, her baby is exposed to high levels of glucose in the womb.
Huh?
This can cause the baby's pancreas to produce more insulin, a hormone that helps regulate blood sugar levels. After birth, when the baby is no longer exposed to those high glucose levels from the mother, their own high insulin levels can cause their blood sugar to drop too low.
Wow. It's like their little bodies are overcompensating, trying to maintain balance in a changing environment. Now, let's move on from hypoglycemia and talk about another challenge that's common in newborns, especially premature babies. Hypothermia.
Hypothermia, right.
What is it, and what are the key things to know about it?
Hypothermia, which is a low body temperature, is a major concern in newborns because they have a harder time regulating their body temperature than older children and adults.
So it's like they're more susceptible to the elements because their internal thermostats aren't quite calibrated yet.
Exactly. Their tiny bodies have a larger surface area relative to their weight, which means they lose heat more easily. And their immature temperature regulation mechanisms make it harder for them to compensate for that heat loss.
Now, your notes highlight several factors that can contribute to hypothermia in newborns, including being born prematurely, having a low birth weight, and experiencing prolonged exposure to cold environments.
Right.
So what are some of the things that parents and healthcare providers can do to prevent hypothermia in newborns?
Well, one of the most effective interventions is immediate skin-to-skin contact with the mother after birth. It's like a natural incubator providing warmth, comfort, and even a dose of beneficial bacteria from the mother's skin.
It's incredible how something as simple as skin-to-skin contact can have such a profound impact. What other preventative measures are recommended?
Maintaining a comfortably warm delivery room is essential.
Okay.
Ensuring that the baby isn't exposed to drafts or cold surfaces, drying the baby thoroughly after birth is also important, as wet skin can significantly increase heat loss.
Right.
Dressing the baby in warm clothing and wrapping them in blankets can help conserve heat. And delaying the first bath until the baby's temperature is stable is another simple but effective strategy.
It's all about creating a cocoon of warmth to help those little bodies conserve their energy and maintain a stable temperature.
Exactly.
Now, what if a baby does develop hypothermia? How is it treated?
Well, the primary goal is to rewarm the baby gradually and safely. For mild to moderate hypothermia, this might involve skin-to-skin contact with the mother using a radiant warmer, which is a device that provides overhead heat, or placing the baby in a warmed incubator.
So it's about providing those external sources of heat to help the baby's body temperature rise. What about more severe cases of hypothermia?
For severe hypothermia, more aggressive measures might be necessary, such as using a heated mattress or warming intravenous fluids. Close monitoring of the baby's temperature and other vital signs is essential during that rewarming process.
It sounds like a delicate balance between providing enough heat to raise the temperature without without overwhelming the baby's fragile system. Now, before we move on from hypothermia, your notes introduce a really interesting concept that's relevant to temperature regulation in newborns, the neutral thermal environment. What exactly does that mean?
The neutral thermal environment is the ideal temperature range for a newborn to maintain a stable body temperature with minimal energy expenditure. It's like a comfort zone where their bodies don't have to work as hard to stay warm or cool down.
So it's about finding that sweet spot where they're neither too hot nor too cold.
Exactly.
How do we create a neutral thermal environment for a newborn?
Creating a neutral thermal environment involves a combination of factors, including the ambient room temperature, the baby's clothing and bedding, and even the humidity level. It's about creating an environment where the baby can maintain a stable body temperature without having to work too hard.
It's all about those little details that can make a big difference. Okay, now that we've covered some of the common challenges that newborns face, let's dive into the world of childhood illnesses. Your notes are packed with information about a whole range of conditions that can affect children of all ages. Let's start with one that's a common concern for parents: pneumonia. What is pneumonia?
Pneumonia is an infection of the lungs that can be caused by viruses, bacteria, or even fungi. It's a common illness in children, and it can range in severity from mild to life-threatening.
So it's a condition that we need to take seriously. What are some of the signs and symptoms of pneumonia in children?
The symptoms of pneumonia can vary depending on the child's age and the severity of the infection. Common symptoms include cough, fever, rapid breathing, difficulty breathing, chest pain, fatigue, and loss of appetite.
Sounds like a pretty miserable experience for those little ones. Now, how is pneumonia diagnosed, and what are the treatment options?
Diagnosing pneumonia often involves a combination of a physical exam, listening to the lungs with a stethoscope, and a chest X-ray, which can reveal the characteristic signs of infection in the lungs. Blood tests might also be done to check for signs of inflammation or infection. Treatment depends on the underlying cause of the pneumonia. If bacteria are the culprits, antibiotics are the mainstay of treatment. For viral pneumonia, supportive care is often the primary approach, focusing on managing symptoms, ensuring adequate hydration, and providing supplemental oxygen if needed.
It's a reminder that not all infections require antibiotics. And sometimes the best approach is to support the body's natural defenses. Now, your notes mention some potential complications that can arise from pneumonia, and they sound pretty serious. What are some of those complications?
Pneumonia can sometimes lead to complications, especially in young children, older adults, and those with weakened immune systems. These complications can include pleural effusion, which is a buildup of fluid around the lungs, empyema, which is a collection of pus in the pleural space, sepsis, which is a life-threatening bloodstream infection, and even respiratory failure, which is when the lungs are no longer able to provide adequate oxygen to the body.
Wow. It's a reminder that even seemingly common illnesses can sometimes take a serious turn.
They can.
Okay, now let's move on from pneumonia and delve into asthma, a chronic condition that affects millions of children worldwide. What are the key things to understand about asthma in children?
Asthma is a chronic inflammatory disease of the airways that causes recurrent episodes of wheezing, coughing, chest tightness, and difficulty breathing. It's a complex condition that's thought to be caused by a combination of genetic and environmental factors.
So it's not just about having sensitive airways. It's about having an underlying inflammatory process that makes those airways more more reactive to triggers. Now, what are some of the common triggers for asthma in children?
The triggers for asthma can vary from child to child, but common triggers include allergens like dust mites, pollen, pet dander, and mold, as well as irritants like smoke, air pollution, and strong odors. Respiratory infections, exercise, cold air, and even stress can also trigger asthma symptoms.
Wow. Sounds like a complex interplay of environmental and internal factors that can set off those airways. Now, what about managing asthma in children? Your notes seem to suggest a multi-pronged approach.
You're right. Managing asthma often involves a combination of strategies, starting with identifying and avoiding those triggers that can set off those airways.
So it's a bit like detective work, figuring out what sets off those asthma symptoms.
Yeah.
And then taking steps to minimize exposure. What are some other key components of asthma management?
Medications are often a cornerstone of asthma management. There are two main types of asthma medications: quick relief medications, which are used to quickly open up the airways during an asthma attack,
Okay.
and long-term control medications, which are taken daily to prevent asthma symptoms and reduce the frequency and severity of those flare-ups.
So it's a two-pronged approach, using medications to both treat uh, acute symptoms and prevent future episodes.
Exactly. And in addition to medications and trigger avoidance, other important aspects of asthma management include educating children and their families about asthma, teaching them how to recognize early warning signs of an attack, how to use their medications correctly, and what to do in an emergency.
It's a reminder that knowledge is power, especially when it comes to managing chronic health conditions. Now, before we move on from asthma, your notes highlight a particularly serious complication that can arise: status asthmaticus. What is status asthmaticus, and
Yeah.
why is it so concerning?
Status asthmaticus is a severe and prolonged asthma attack that doesn't respond to usual treatments. It's a life-threatening condition that requires immediate medical attention.
So it's like an asthma attack that's spiraled out of control, and the airways are so constricted that it's incredibly difficult to breathe.
Exactly. It's a medical emergency that requires hospitalization and intensive treatment to open up the airways and restore normal breathing.
Wow. It's a stark reminder that asthma, while often manageable, can sometimes be a very serious condition. Okay, now let's move on from asthma and talk about another respiratory condition that's common in young children. Croup. What is croup, and what are its distinctive features?
Croup, also known as laryngotracheobronchitis, is an inflammation of the upper airway, specifically the larynx, trachea, and bronchi. It's usually caused by a virus, and it's characterized by a distinctive barking cough, stridor, which is a high-pitched sound made during breathing and difficulty breathing.
So it's like an upper respiratory infection that affects the the voice box and the windpipe,
Exactly.
causing that characteristic barking cough.
Yes. And it typically affects young children, usually between 6 months and 3 years old. The good news is that most cases of croup are mild and resolve on their own within a few days.
So for the most part, it's a self-limiting condition. What about those more severe cases? How are they managed?
For mild cases of croup, home care often suffices, focusing on keeping the child comfortable, providing Tool humidified air to ease breathing, and hospitalization might be necessary.
So when should parents seek medical attention for croup? Are there any red flags that should prompt a trip to the doctor or the emergency room?
Your notes highlight several warning signs that should prompt a trip to the doctor or emergency room. These warning signs include difficulty breathing, a bluish tinge to the skin, drooling or difficulty swallowing, and agitation or restlessness.
It sounds like it's about recognizing those signs that the child's breathing is compromised,
Right.
and seeking medical attention promptly. Now, before we move on from croup, your notes mention an interesting radiological finding that's often seen in this condition: the steeple sign. What is the steeple sign, and why is it relevant?
The steeple sign is a characteristic narrowing of the subglottic airway, which is the area of the trachea just below the vocal cords that's seen on an X-ray of the neck in children with croup. The narrowed area resembles the shape of a church steeple, hence the name.
Oh, interesting. So it's like a visual hallmark of croup on imaging studies. Now, moving on from croup, your notes dive into bronchiolitis, another common respiratory infection in young children.
Yeah.
What is bronchiolitis, and what are its distinctive features?
Bronchiolitis is an inflammation of the bronchioles, which are the smallest airways in the lungs. It's most commonly caused by a virus called respiratory syncytial virus, or RSV,
Okay.
and it typically affects infants and young children.
So it's like an infection that reaches those tiniest branches of the respiratory tree, those delicate bronchioles.
Exactly, and it can cause a range of respiratory symptoms, including cough, wheezing, rapid breathing, and difficulty breathing.
Sounds like it could be quite distressing for those little ones. Now, how is bronchiolitis treated?
Most cases of bronchiolitis are mild and resolve on their own with supportive care. This might involve using a humidifier to add moisture to the air, suctioning the nose to clear mucus, offering small frequent feedings to prevent dehydration, and providing supplemental oxygen if needed. But in more severe cases, hospitalization might be necessary to provide more intensive respiratory support.
It sounds like a delicate balance between supporting the child's breathing and allowing their body to fight off the infection.
Exactly.
Now, before we move on from bronchiolitis, your notes raise a question about the long-term implications of this condition. What's the concern?
Some studies suggest that severe bronchiolitis in infancy might be linked to an increased risk of developing asthma or other respiratory problems later in life.
Okay.
However, more research is needed to fully understand this potential connection.
It's a reminder that even seemingly common childhood illnesses can sometimes have long-lasting effects.
Yeah.
Okay. Now, moving on from bronchiolitis, your notes delve into another respiratory infection that's caused by bacteria. Tuberculosis or TB. What are the key things to understand about TB in children?
Tuberculosis is a serious bacterial infection that primarily affects the lungs, but it can also affect other parts of the body like the lymph nodes, bones, and even the brain. It's caused by a bacterium called Mycobacterium tuberculosis, and it spreads through the air when an infected person coughs or sneezes.
So it's a contagious illness that can have serious consequences if left untreated. Now, what are some of the key things to understand about TB in children? How does it present, and what are the challenges in diagnosing and treating it?
One of the challenges with TB in children is that the symptoms can be subtle and nonspecific, often mimicking other common childhood illnesses.
Oh, okay.
This can make diagnosis more difficult, leading to delays in treatment.
So it's a condition that requires a high index of suspicion, especially in children who might not be able to clearly articulate their symptoms. What are some of the signs and symptoms that might raise a red flag for TB?
Some common symptoms of TB in children include a persistent cough that lasts for more than 2 weeks, fever, weight loss, fatigue, night sweats, and loss of appetite.
Wow. It sounds like a constellation of symptoms that might not immediately scream TB, but when they persist, further investigation is warranted.
Exactly. And if TB is suspected, a combination of tests might be used to confirm the diagnosis, including a tuberculin skin test, also known as the Mantoux test, a chest x-ray, and sputum cultures, where a sample of mucus is collected and analyzed for the presence of the TB bacteria.
So it's a multi-step process to confirm the diagnosis. Now, once TB is diagnosed, what are the treatment options?
The good news is that TB is treatable with antibiotics. However, treating TB requires a long course of therapy, often involving a combination of multiple antibiotics taken for several months, and adherence to the medication regimen is crucial for successful treatment and to prevent the emergence of drug-resistant strains of TB.
Wow. It's a reminder that taking those medications as prescribed, even when you start feeling better, is absolutely crucial for eradicating the bacteria and preventing a relapse. Now, your notes wrap up this section on TB with a question about the global effort to eradicate this disease. What are some of the challenges and successes in the fight against TB?
The global fight against TB has made significant progress in recent decades, with millions of lives saved through effective treatment and prevention programs. However, TB remains a major public health challenge, particularly in low-income countries where access to healthcare and resources is limited.
So it's a battle that's being won on some fronts, but there's still a lot of work to be done to achieve global eradication.
Exactly. The challenges include poverty, overcrowding, malnutrition, HIV infection, which weakens the immune system and makes people more susceptible to TB, and the emergence of drug-resistant strains of TB, which are more difficult to treat.
It's a complex interplay of factors that require a comprehensive and sustained effort to address. Now let's move on from TB and talk about another highly contagious illness that's made a resurgence in recent years: measles. What is measles, and what are the key things that parents and healthcare providers need to know about it?
Measles is a highly contagious viral illness that causes fever, cough, runny nose, red watery eyes, and a characteristic rash. It's a serious illness that can cause a range of complications, including pneumonia, encephalitis, and even death.
It's a reminder that even seemingly common childhood illnesses can sometimes have serious consequences. Now, what are the key things that parents and healthcare providers need to know uh, about measles? You know,
Yeah.
how is it spread? How is it prevented? And what are the treatment options?
First and foremost, measles is preventable through vaccination. The MMR vaccine, which protects against measles, mumps, and rubella, is highly effective and safe. It's typically given in 2 doses, the first at 12 to 15 months of age and the second at 4 to 6 years of age.
So it's a two-dose vaccine that provides long-lasting protection against these three viral illnesses.
Exactly. And widespread vaccination has dramatically reduced the incidence of measles, but outbreaks can still occur, especially in communities with low vaccination rates.
It's a reminder that herd immunity, where a large percentage of the population is immune to a disease, is crucial for protecting those who are unable to be vaccinated, like infants or those with compromised immune systems. Now, your notes mentioned a specific feature of measles that often helps confirm the diagnosis. Complex spots. What are complex spots?
Koplik spots are small white spots with bluish-white centers that appear inside the mouth, usually on the inner lining of the cheeks, a couple of days before the measles rash develops. They're a classic sign of measles and can help distinguish it from other viral illnesses that can cause similar symptoms.
So it's like a telltale sign that measles is on its way. Now, what about treating measles? Is there anything that can be done to shorten the course of the illness or prevent complications?
Unfortunately, there's no specific antiviral medication for measles. Treatment is primarily supportive, focusing on managing symptoms like fever and cough, ensuring adequate hydration, and providing supplemental oxygen if needed.
So it's about you know supporting the body's natural defenses and allowing the immune system to fight off the virus.
Exactly, and it's important to watch for signs of complications like pneumonia or encephalitis and seek medical attention promptly if any concerns arise.
It's a reminder that even seemingly common childhood illnesses can sometimes take a serious turn.
Okay, now let's move on from measles and talk about a viral illness that's spread through the bite of an infected animal. Rabies. What is rabies and why is it such a serious concern?
Rabies is a serious viral infection that affects the central nervous system. It's almost always fatal if left untreated.
So it's a condition that we need to take very seriously. Now, how is rabies transmitted, and what are the signs and symptoms?
Rabies is typically transmitted through the bite of an infected animal, most commonly bats, raccoons, skunks, and foxes. The virus travels from the bite wound through the nerves to the brain, where it causes inflammation and damage. So it's a virus that hijacks the nervous system, attacks the brain. What are some of the early signs of rabies? How does it typically present?
The early symptoms of rabies can be nonspecific and might include fever, headache, muscle aches, fatigue, and loss of appetite. But as the virus progresses, more serious neurological symptoms can develop, including agitation, anxiety, confusion, hallucinations, seizures, and paralysis.
Wow, it sounds like a terrifying and devastating illness. Now, is there any treatment for rabies? If someone is bitten by an animal that's suspected of having rabies, what should they do?
If a person is bitten by an animal that's suspected of having rabies, it's crucial to seek medical attention immediately. Post-exposure prophylaxis, or PEP, can prevent rabies from developing if it's started soon after exposure. PEP involves a series of injections, including rabies immunoglobulin, which provides immediate protection against the virus, and rabies vaccine, which helps the body build its own immunity.
So it's a race against time to prevent the virus from reaching the brain and causing irreversible damage.
Exactly.
Now, shifting gears a bit, your notes delve into a common but often uncomfortable problem for children: urinary tract infections, or UTIs. What are the key things to know about UTIs in children?
UTIs are infections of the urinary tract, which includes the kidneys, ureters, bladder, and urethra. They're more common in girls than boys, and they can occur at any age.
Now, what are some of the signs and symptoms of a UTI in a child? How do they typically present?
The symptoms of a UTI can vary depending on the child's age and the location of the infection. Common symptoms include pain or burning during urination, frequent urination, urgency, or the feeling of needing to urinate even when the bladder is empty, fever, abdominal pain, and even blood in the urine.
It sounds like a pretty miserable experience. How are UTIs diagnosed and treated?
Diagnosing a UTI typically involves a urine test, where a sample of urine is analyzed for the presence of bacteria. If bacteria are found, a urine culture might be done to identify the specific type of bacteria and determine which antibiotic will be most effective. Treatment typically involves antibiotics to kill the bacteria and prevent the infection from spreading.
So it's about targeting those bacteria with the right medication to clear up the infection. Now, moving on from UTIs, your notes introduce a condition that affects the kidneys, nephrotic syndrome. What is nephrotic syndrome, and what are the hallmarks of this condition?
Nephrotic syndrome is a kidney disorder that's characterized by heavy proteinuria, which is the presence of large amounts of protein in the urine. Hypoalbuminemia, which is low levels of albumin, a protein that's normally found in the blood. Edema or swelling, especially around the eyes, legs, and feet. And hyperlipidemia, which is high levels of cholesterol and triglycerides in the blood.
So it's a condition that affects the kidney's ability to filter the blood properly, leading to a loss of protein and other substances in the urine.
Exactly. And those lost proteins are essential for maintaining fluid balance in the body, which is why edema or swelling is a common symptom.
Now, what causes nephrotic syndrome?
The underlying cause of nephrotic syndrome is not always clear, but it can be triggered by a variety of factors, including infections, certain medications, and even underlying medical conditions like diabetes or lupus. In some cases, it might be an autoimmune disorder where the body's immune system mistakenly attacks the kidneys.
It sounds like a complex condition that can have a variety of origins. Yeah. Now, how is nephrotic syndrome managed?
Managing nephrotic syndrome typically involves a combination of medications, lifestyle modifications, and sometimes dietary changes. Corticosteroids are often used to reduce inflammation in the kidneys and decrease proteinuria. Diuretics might be prescribed to help reduce edema.
So it's about addressing both the underlying inflammation and the symptoms. What about those lifestyle modifications and dietary changes?
Lifestyle modifications might include limiting salt intake to help reduce edema and getting regular exercise to improve overall health. Dietary changes might involve reducing protein intake to ease the burden on the kidneys and limiting saturated fat and cholesterol to help manage hyperlipidemia.
It's a reminder that managing chronic health conditions often requires a holistic approach that addresses both the physical and lifestyle factors. Okay, now let's move on to another condition that's mentioned in your notes. Enuresis. What is enuresis, and what are the different types?
Enuresis is the medical term for bedwetting. It's a common problem in children, and it can be incredibly frustrating for both the child and their parents.
I can imagine. It's like a step backward in potty training. And it can be, embarrassing and stressful for everyone involved. Now, there are two main types of enuresis: primary enuresis and secondary enuresis. What's the difference between those two?
Primary enuresis is when a child has never achieved bladder control at night.
Okay.
Secondary enuresis is when a child has been dry at night for at least 6 months, but then starts wetting the bed again.
So the distinction is whether the child has ever been consistently dry at night. What are some of the potential causes of enuresis? Why does it happen?
The causes of enuresis can vary, but they often involve a combination of factors, including a small bladder capacity, delayed maturation of the nervous system, which controls bladder function, sleep disorders, hormonal imbalances, stress or anxiety, and even underlying medical conditions like urinary tract infections or constipation.
Wow, it sounds like it's often a multifactorial problem. Now, how is enuresis managed? What are some of the treatment options?
Managing enuresis often involves a combination of behavioral therapies, lifestyle modifications, and sometimes medications. Behavioral therapies might include bladder training, reward systems for dry nights, and even moisture alarms which wake the child up when they start to wet the bed.
So it's about helping the child develop better bladder control and awareness. What about those lifestyle modifications and medications?
Lifestyle modifications might include limiting fluids before bedtime, encouraging regular toilet breaks during the day, and addressing any underlying constipation. Medications like desmopressin, a synthetic hormone that reduces urine production, might be prescribed in some cases, but they're typically used as a short-term solution.
It's a reminder that managing bedwetting often requires a patient and multifaceted approach.
Okay,
Right.
now let's move on to another condition that affects the kidneys. Acute Glomerulonephritis. What is acute glomerulonephritis and what causes it?
Acute glomerulonephritis, or AGN, is an inflammation of the glomeruli, which are the tiny filters in the kidneys that help remove waste products and excess fluid from the blood. It's often caused by an infection, most commonly a streptococcal infection, like strep throat. So it's like an immune response that's gone awry, attacking the kidney's filtration system.
Exactly. And it can lead to a range of symptoms, including hematuria, which is blood in the urine, proteinuria, which is protein in the urine, edema or swelling, high blood pressure, and decreased urine output.
Wow. It sounds like a serious condition that can disrupt the kidney's ability to do their job. Now, how is acute glomerulonephritis diagnosed and treated?
Diagnosing AGN typically involves a combination of a physical exam, urine tests to check for blood and protein, and blood tests to assess kidney function. Treatment often involves addressing the underlying infection, typically with antibiotics, and managing symptoms like high blood pressure or edema.
So it's about tackling both the cause and the consequences of the inflammation.
Exactly.
Now let's shift gears a bit and talk about a common childhood ailment that's often associated with pain and fever. Acute otitis media, or AOM. What is AOM and why is it so common in children?
Acute otitis media is an infection of the middle ear, the space behind the eardrum. It's incredibly common in children, especially those under the age of 5, and it's often triggered by a viral upper respiratory infection, like a cold.
So it's like those viral invaders make their way up the eustachian tube, the tube that connects the middle ear to the back of the throat, and set up shop in the middle ear.
Exactly. And this can lead to a buildup of fluid behind the eardrum, creating a breeding ground for bacteria, which can then cause a bacterial infection.
Wow, it's a reminder that those seemingly simple colds can sometimes have cascading effects. Now, what are some of the signs and symptoms of AOM?
The classic symptoms of AOM include ear pain, fever, irritability, fussiness, and even drainage from the ear. Children with AOM might also pull or tug at their ears, have difficulty sleeping, and experience hearing loss.
Sounds like a pretty miserable experience for those little ones.
Yeah.
Now, how is AOM diagnosed and treated?
Diagnosing AOM involves a physical exam where a healthcare provider uses an otoscope, a lighted instrument, to look inside the ear canal and examine the eardrum. The eardrum will often appear red and bulging if there's an infection. Treatment for AOM depends on the severity of the infection and the child's age.
So it's not a one-size-fits-all approach. What are some of the treatment options?
For mild cases of AOM, watchful waiting might be appropriate. This involves monitoring the symptoms and allowing the body's immune system to fight off the infection. But if the symptoms are severe or don't improve within a couple of days, antibiotics might be prescribed.
So it's about balancing the benefits of antibiotics
Yeah.
with the risks of overuse and antibiotic resistance.
Yeah.
Now, before we move on from ear infections, your notes touch upon another condition that affects the ear. Otitis externa, or swimmer's ear. What is swimmer's ear, and how is it different from AOM?
Otitis externa is an infection of the outer ear canal, the tube that leads from the outer ear to the eardrum. It's often called swimmer's ear because it's frequently caused by water that gets trapped in the ear canal after swimming, creating a moist environment where bacteria can thrive.
So it's like a localized infection in the ear canal,
Right.
unlike AOM, which affects the middle ear. Now, what are some of the signs and symptoms of swimmer's ear? How does it present?
Swimmer's ear typically causes ear pain, itching, redness, and swelling in the ear canal. There might also be drainage from the ear, and it can be painful to touch the outer ear.
So it's pretty uncomfortable. How is a swimmer's ear treated?
Treatment for swimmer's ear typically involves antibiotic ear drops to kill the bacteria. Over-the-counter pain relievers like ibuprofen or acetaminophen can help manage pain and fever. It's also important to keep the ear dry while it's healing.
So it's about targeting the infection and providing symptom relief while allowing the ear canal to heal.